Make sure you hit the notification button so you know exactly when I come on. I appreciate all of you for what you do. This is your PTA coach. We are back this evening, and I'm just answering questions. Okay, a lot of you have watched my videos. You checked out my shorts. I've talked a lot about getting ready for the state exam. Right, we know it's coming up very soon. The next one is in July, and we also have one in October. Okay, so tonight it's just freestyle. You want to ask me about the workshop that I host? What do we do there? What do we talk about? The topics, how I want you guys to prep. Any general questions you have for me, now is your time to ask. I just have a few minutes to spare tonight, guys, and I figured why not? Why not go live and just answer your questions? Okay. Now, you guys know I'm always walking around, so to speak, with this book. So I have the book right next to me, and while you guys are thinking of what to ask me, I just have a lot of things actually, right? But a few things I want to talk about tonight. Okay, a few things I want to talk about right now. I'm on musculoskeletal system, and I've said this before in my analysis. It's almost impossible to pass the exam if we don't pass three of the five major areas, right? Musculoskeletal is one of them. Cardiopulmonary is one of them, and also the nervous system. To me, it accounts for almost 60% of the exam. And if we need a 600 minimum to pass, then it is imperative that we actually nail down a lot of these concepts. It's funny, now that I just sit here, guys, I'm not actually studying for to take the state board, but just looking more at this book. Now, once again, I know I keep talking about the book. If you use apps or websites or any other books, it's fine. Okay. This is just like my very convenient reference point for a lot of things that I share with a lot of you. Now, as I was getting ready to go live today, or a few minutes ago rather, I saw a few things in the musculoskeletal chapter. Okay. There's a couple of tests that could be done by a therapist to check for certain things. Okay. This right here is talking about hip contracture and tightness. Hip contracture and tightness. So we have things like the Ellie's tests, the Ober's tests, the piriformis test. Okay, I'm just reading out these different types of tests. The Thomas test, the tripod sign, the 90-90 straight leg raise. Okay, so these are all things that tests that are being done or that can be done for patients, right? To test for hip contracture. Now, once again, make sure that you know the difference between each. Okay, what is each test checking for? Yes, it's the hip, but what part of the hip? Is it the piriformis? Is it the iliotibial band? What is it that they're checking for? Okay, you want to know that. Is it the rectus femoris? For example, if it's the Ellie's test, right? I'll just read it to you guys real quick. It says here, Ellie's test. The patient is positioned in prone while the therapist passively flexes the patient's knee. A positive test is indicated by spontaneous hip flexion occurring simultaneously with knee flexion and may be indicative of a rectus femoris contracture. Guys, help me welcome to the channel Musa. Musa, welcome to my channel. Ultra, also welcome to my channel. Thanks for joining. So the reason I have my flashlight, guys, I don't want to turn on the lights right now. I don't want the additional heat. I just want this place nice and calm. It's Sunday evening. I just want to share a few things with a lot of you, okay? So once again, pictures. Are they important? Yes. Let me just show you guys this real quick. Pictures. Very important. You have to be able to know the difference, okay? Now, these tests right here are being performed by this therapist is checking for different things. Make sure you know the difference. Make sure you actually know the difference, okay? Make sure you know the difference. Now, there's also some type of test that can be performed for, they call it right here, ligamentous instability, okay? Mostly in the knee joint. So if you look at things like this, like we have the Lachman test, we have the anterior drawer test, okay? We have the lateral pivot shift test, posterior drawer test. Make sure you know the difference. Make sure you know the difference. Once again, pictures, guys. Pictures. Pictures, a bunch of pictures. Make sure you actually know the difference. Okay. Very important. Very, very important. Can't say it enough. All right. So also in each chapter, well, let me just say this real quick, right? The exam is coming up soon, right? We have like less than what is today, guys? Today's the 14th. We have we have what? Less than 3 weeks to go. Less than 3 weeks to go to get this exam popping. I'm talking about 180 hot questions just coming at you like boom, like bam. And we have to make it. We have to pass this exam. Okay. And so I've told you guys that it's possible. I mean, I did it, right? I'm licensed in the state of Texas. Okay, so everything I tell you is legit. Everything I talk about, there's a reference point. And when you come to the workshop, you hear me talking about this a lot. When we go through questions and we answer the questions, by the way, guys, my workshops are very interactive. Okay, so you come in, you will be a part of it. I will have you guys reading stuff, getting information, answering questions, asking questions. So it's a collaborative effort. When you come in, we get this done together. Okay. So there's always a reference point for everything that we talk about in here. Okay. Look at this, guys. Open chain exercise versus closed chain exercise. Do you think it's important? I think so. You might want to go check it out and find out what they're talking about in there. Okay. Open chain versus closed chain. One of them, your extremities are fixed, and one of them, your extremities are moving. Okay. So make sure you review that. Guys, help me welcome to the channel, MJ. MJ, welcome to my channel. Thank you. All right, let's see what else we got here. See, that's the thing. You guys have very good questions, right? Like, and the advice I will give all of you, don't limit yourself to what we talk about in the workshop because anything that we've learned in this book or in the app or websites and stuff like that when it comes to PTA school is fair game. I have to be very clear about that. Okay. I have to be very clear. The fundamentals don't change. A lot of things that I show you guys in here to get you through, those don't change. Now your knowledge base would be your knowledge base, right? And so with 2 weeks, yeah, pretty much like 2 or 3 weeks left, we're doing active reviews. That's why I present you guys with practice questions. Practice questions. That's what I present you guys with, right? So you guys can actually practice and get better. And don't worry if you miss the question. Missing a question is actually a good learning tool, okay? Because then you can go back and read and research, find out why you got it wrong, and use the reference points that I talk about to get the correct answer, okay? All right, ask your questions, guys. Any questions you have for me, ask when it comes to the workshop. Ask, 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 okay? Let me see what else, guys. There's so many things power packed in one chapter alone. And when you get to the end of the chapters, when you're reviewing, please go through those exercises. I'm talking about the ones that have questions for you. Make sure you go through those exercises. Okay. A lot of you ask when is the next workshop. I'm very flexible, by the way, guys. As far as long as it's evenings, it can't be like morning hours for now because I have a full-time job that I do, and so it has to be like evening hours. But if we have enough people, even if you want to do one-on-one, we can do that also. Okay. It doesn't always have to be like a group workshop thing. You want to talk to me, you want to chat, you need some help, send me an email, right? It's my last name, AKALUSO, the number 40 at gmail.com. Okay. That is my email. Very simple. Send an email. I'll make contact with you. We'll chat, kind of find out where you are, and then go through the process of helping you to pass this exam. I've said this so many times. For a lot of you, it might not be the same challenges, so to speak. A lot of you are very knowledgeable, right? Maybe it's your test taking skills, or just learning how to put things together to answer a question. Because sometimes when you look at a question, the answer, when I give you a reference point, right, it's going to help you get to the answer, but you have to put a lot of things together sometimes to make that answer, to get the how do I put this to you guys? Some of the questions, right, in my analysis, like the practice questions that we go through, those reference points will help you get the right answer. Sometimes you have to add a little bit more to get to the answer, right? So that's just what it is. So what I wanted to look at right now is I'm still on musculoskeletal system, and let me go all the way down. So the summary, guys. Um, when you're doing your reviews, check out the summary. Okay, these are all summaries. Sorry, guys, I'm waving my phone at you guys. Summaries. Check out these summaries. Okay. What else? So as far as practice exams, by now, technically, you should have already had like three practice exams, right? Like done. You know where you stand. Okay, I'm 85%, I'm 75%, I'm 45%. You should know where you stand right now. And we need to cover up those gaps quickly, right? Because we don't have any more time. That's just the truth of the truth of the truth. No more time. The exam is around the corner and we have to cover those gaps. Okay. Now, let me make a quick correction. I've been telling you guys, see, for the exam, we have 6 lifetime attempts, right? That is actually true for my state. Like I'm based out of Texas, and so we have 6 lifetime attempts to take the state board exam and pass. Now, if you live in Florida and different places, I'm made to understand that you have more chances, right? But either way, we don't want to exhaust all our chances. We want to take this and pass the exam. That's the point. Whether you have lifetime attempts or 8 or 5 or whatever the case might be, the key thing is we want to cross the bridge. If you watch some of my old videos, like I talked a lot about crossing the bridge. And when I say crossing the bridge, I mean getting to the point of getting your license. Okay. That's what we want to get to. Okay. And so that's my goal for all of us. And we can do this. We can completely do this. So going back to what I was saying earlier, for some of us, our knowledge base is very high. Maybe it's just our test taking skills. For some of us, our knowledge base is on the lower side. For some of us, there's some kind of gaps, and we need to cover those gaps. And for some of us, it's just fear, right? Fear. But once again, reach out to me. We can talk about it. Let's start the plans. Let's put something together and put an action plan together to get you to pass this. Once again, if you've gone through other review courses, and have not achieved success, you took the exam the first time, did not pass second, did not pass third, did not pass fourth, you fell short. A lot of things have to change. I know some of you have heard me say this before, but it's just the truth. If we're going to pass this exam and move on and get jobs and all that good stuff, then a lot has to change. Bits and pieces of the puzzle need to be put together immediately. That's just what it is, right? And so we need to do that. We need to do that because imagine that you've gone to school for 2 years or 19 months or whatever the case might be, and all this boils down to 4 hours. A 4 hour exam. We have to get this. And I want to show you guys how to get it done. Okay? Because I did it and I truly believe that all of you can do it. It's possible. All right. So what else? What else, guys? Any questions you have for me, please ask. Once again, the summary of all these chapters, kind of go and review. Okay. Review. Let's see what else. What else? So tomorrow morning, hopefully, I want to present some more practice questions for us to go over. Okay. I'm not gonna be on for too long because, of course, tomorrow is Monday and it's back to work, guys, back to the hustle. And so I'll be on briefly, present some questions, hopefully, and then I have to push and go. Okay. What else do I want to talk about in this chapter? So, with pathologies in general, okay, this is just from my little knowledge, guys. I'm not saying I know everything. From pathologies alone, I want you to understand the pathologies, okay? And once you understand those pathologies and how they affect the body, right? Because now we're talking about physical therapy, right out the box, right? If, let's say, for example, Parkinson's, okay? I'm just giving one broad example. What does Parkinson's do? How does it present? There's a levodopa deficiency, right? And so what happens? There's slow movement, okay? There's shuffling gait. Those are some of the things to think about, right? So, from the therapy standpoint, what do we want to promote? We want to promote safety, right? Think about it. We want to improve gait. We also want to improve joint integrity. See, once again, guys, when you start to understand all these pathologies, you're trying to pretty much do, let me use the word opposite of what's going on to help the patient, if that makes any sense. So if they're having a shuffling gait pattern, you don't want them having that shuffling gait pattern. So what is the physical therapy intervention for that? Now, once again, guys, you always follow the treatment goals of the supervising physical therapist. I'm just sharing like knowledge with you guys to help you understand a lot of these things, and it's going to help you navigate the process. If the problem is swelling, like edema, what will be the opposite? You want some kind of treatment that will reduce the edema, right? Do you guys kind of get where I'm going? So you're always doing the opposite of what's going on to help the patient either recover or improve or whatever the case might be. Once again, you follow the treatment goal of the supervising therapist. Okay. What else, guys? Posture, faulty posture. A faulty posture, sometimes a lot of pathologies affect posture. So if posture is affected, what's going to happen is possibly going to affect the patient's gait. It's possibly going to be like a risk. Let's say like they had a stroke and one side is paralyzed, so to speak. Okay, paralysis or hemiplegia. Let me use the word hemiplegia. Okay, if they're hemiplegic, that's going to affect posture. It's also going to affect gait. So what are you going to work on with patients like that? You're going to work on their posture. You're going to work on strengthening their extremities. So, guys, a lot of times, going back to a video that I posted a while, not too long ago, I want you to focus more on understanding a lot of these pathologies. Once you start to understand the pathologies, like what is it that is going on, how is it presenting, okay, and what will be the intervention, you find out that a lot of things you don't have to memorize. We still have things in here that need to be memorized. Like if it's things like BMI calculation, what's the normal sugar level that a patient should have, what's normal I'm sorry, what's normal blood pressure, all those things. Yes, we still have to memorize those numbers and know what's normal and abnormal. But once you start to understand a lot of these pathologies, coming up with the intervention is almost like intuitive, right? And so that's why I keep talking about knowledge base. For some of you, your knowledge base is very high, like you know a lot, right? Because right now you're actively studying for the exam. So you're reading through a lot. But just take some of these tips from me. I mean, this is a guy that has been doing this for a long time. We're pushing on 10 years, guys. Okay. The channel itself is new. That's why, like right now, I have 105 subscribers, I believe. It's fairly new, but I'm not new to the world of physical therapy. Once again, I've worked in different settings, skilled nursing facility, home health, hospital, outpatient. So I have a lot to share with a lot of you. Okay. So don't panic when it comes to the state board exam. You can do this. I did it. When I went back to school, guys, I was older than almost half of the people in the class at that time, and I did it. So we can get this done. It's 180 hot questions coming at us. We have 4 hours to get this. We can do this. You'd be surprised. You know a lot more than you think. You know a whole lot more than you think. Okay. Let's see what else do I have to share with you guys. Thank you for the likes, guys. Thank you so much. Thank you for the likes. I'll try as much as possible to come in the evenings, guys, because I noticed that of course, um there seems to be a higher turnout certain times of the day compared to others, right? I just kind of noticed that. So I try to come on in the evenings as much as possible, share more information with a lot of us. But I want you guys to go out there and get this done. Like absolutely. Okay. So yeah, think of the pathology, think of what's going on with the patient, and what will be the intervention. Okay. Okay. Look at this, guys. Let me read this to you guys. Lateral epicondylitis. Okay. What condition produces a patient's symptoms? Let's just read this real quick. It's also known as tennis elbow. It's characterized by inflammation or degenerative changes at the common extensor tendon that attaches to the lateral epicondyle of the elbow. Okay. The primary symptom of this condition is pain. So let's think about it for a second. What's going on with this patient is pain. So what will be the goal with this patient, right? We want to reduce pain. We want to do the opposite. Reduce pain. They already told us what caused the pain. Okay. Now, it says here an injury was most likely sustained to which structure? What part of this structure was injured? Let's just read this real quick. It's repeated overuse of the wrist extensors. Repeated overuse of the wrist extensors. So, repeated overuse led to inflammation. All right. So, let's see here. Which one exactly? It's the extensor carpi radialis brevis. Okay. It says it can produce tensile stress and result in microscopic tearing and damage to the extensor tendon. So it's the extensor carpi radialis brevis. So I've told you guys before, right? Like as far as these topics for every pathology, there's different ways a question could come through on this lateral epicondylitis. They can ask you like what muscle, what is being overused. Well, now we know, yeah, it's the wrist extensors. Well, now which one is it? Extensor carpi radialis brevis. That's a lot of words, right? But we know what it is. So now I want to read something to you guys. Give me 1 second. All right. So remember what I told you guys? What's going on, right? What's going on with the patient is pain, right? Because of overuse of the wrist extensors. Okay. So what is the goal with that, guys? If they're going through pain, we want less pain. Okay. We want that structure to heal. We want the opposite of whatever is going on with that. Now it says here management. Let me just read this to you guys real quick. It says here, what is the most effective management for this patient? Now it says here, medical management initially treats the pain. See, I told you guys, you want to deal with the pain. And this is the case in real life. Like when I go to see patients, right? If I walk in there and they're telling me they're dealing with pain, that's the first thing I'm going to address before we start any type of physical therapy intervention or treatment. If they're in pain at the moment, we have to address the pain first. This pathology right here has to do with pain. So look at what they said. Let me just repeat this. It says here medical management initially treats the pain and inflammation through protection, rest, ice, compression, and elevation. Okay. During the initial phase, the patient should avoid all activities that aggravate the injury. So if This came through overuse. We want underuse. Let me just use that terminology. We want to rest that muscle. Okay. Now, it says here pharmacological intervention should include NSAIDs to alleviate pain and inflammation. Modalities may also be used, such as phonoparesis with hydrocortisone or iontophoresis with dexamethasone. So now, guys, they're talking about intervention. Remember, I told you guys, you want to understand the pathology first. What is going on with the patient? How does it present? And what will be the physical therapy intervention for that? How do you intervene? If pain is the issue, we want to reduce pain. If overuse is the problem, we want underuse, right? Now they're talking about how to treat the pain if there's inflammation. Dexamethasone, right? Using iontophoresis. So there's different ways to ask about this question. Earlier, like I said, guys, they might ask you a question like, what muscle is being overused in this case? Extensor carpi radialis brevis. That's a lot of words, guys. Extensor carpi radialis brevis. Okay, let's just read that one more time. Yes, extensor carpi radialis brevis. Okay, so this is just an example, guys, and the same thing with all the other pathologies that we run into. If you start talking about things like hypertension, what's causing the hypertense? What's causing the hypertension? If blood pressure is too high above normal, what do we want to do? We want to bring it down to something close to normal. See, guys, see? And how is that done? Most likely, rest is one of them. Most likely, there's going to be a pharmacological intervention. Most likely, there's going to be some kind of exercise intervention, right? Because if the vessels or veins are tensed, the blood pressure is high. So we probably want some kind of modality. No, let me not use the word modality. We want some kind of treatment, okay, that would vasodilate the veins so that blood could flow the way it needs to flow. And why is it also hypertensive? Is there some kind of plaque? Is there plaque in there to where blood is not flowing the way it needs to flow? So once again, think about the pathology, understand what's going on with it. And like I told you guys earlier in another video, once you start to understand a lot of these pathologies, it's almost intuitive to come up with the intervention. If everything I'm saying is making kind of a little bit of sense to you guys, that would be great. But when you come to the workshop, I go into detail. Okay. All right. What else do I want to talk about here? So musculoskeletal system is power packed with a lot of questions, a lot of things, a lot of ways that they can ask us questions, and we have to be able to answer those questions. Okay. So keep reviewing. A lot of you that want to join the workshop, once again, my email address is akaluso, the number 40 at gmail.com. Okay. Also, when it comes to the muscles, another thing I want to share with a lot of you is make sure you know where they are. Okay. Nobody ever knows every single thing, but for the sake of the exam, make sure you know where your muscles are. Know where those muscles are, know what they do, and know how those muscles can be stretched. And I've said this a lot of times. To stretch a muscle, you perform the opposite action of that muscle. Okay. Also, with the muscles, you want to know what nerves innervate those muscles. Okay. Make sure you know that. When you come into the workshop, we do an all-out review on the muscles, right? And the nerve innervation and the muscle action. You get that in the workshop. Okay. Review. Once again, I've said it so many times. I don't teach from scratch. Okay. I don't teach because it's a waste of your time. It's a waste of your money. When you come into the workshop, we dive into the practice questions. And once again, before you join the workshop, I send you topics of what I will be talking about in the workshop. So when you come in, you're prepared. Okay. All right. So yeah, once again, make sure you know where those muscles are. Make sure you know what they do. Make sure you know how to stretch those muscles. And also make sure you know about the nerves that connect to those muscles. There's a lot of nerves out there, right? But make sure you know the nerves that connect to those muscles. Okay. I think we're about to stop right now, guys, in a few minutes, and I have to go do some other things. I appreciate you guys for joining. Who else is in the channel? Guys, help me welcome to the channel. Hello, hello, welcome to my channel. Hi, welcome to my channel. Alexon, welcome to my channel. Ultra, welcome to my channel. Musa, welcome to my channel. Okay. All right. So we'll stop here for tonight. For I was about to say to now. We'll stop here for tonight. I appreciate you guys joining. Make sure you gain the wisdom, use the wisdom of the things that I've talked about tonight as you go through your review. And a lot of things I start to say to you guys will start to make a lot of logical sense to you once you do your reviews. And all these things are possible, guys. All these things are possible. It's just, it takes a mindset, takes time, takes dedication. And trust me, this exam will test all those things. It will test your persistence. It will test your patience. It will test your knowledge. It will test your, I said taste. It's Sunday night, guys. It will taste your perseverance. Everything will be on test. Yes. Real quick things like how to measure joint movements using a goniometer. Okay. So what am I talking about? I'm talking about things like this right here. If you can see what I'm talking about. Okay. All these measurements. Make sure you know where it should be placed, where the movable arm stays, where the stationary arm stays. Make sure you know all those things. They're all important. They're all very important. Sometimes you guys ask me questions like, what should I focus on? Well, a lot of things are important. I'm not going to tell you to focus on one thing and leave the other because that one thing that you don't focus on, maybe when you go into the exam, maybe that might be things that they ask you about. I don't know. Okay. All right. So we'll stop here for tonight. I appreciate you guys joining. Please like, share, and subscribe. Make sure you hit the notification button so you know exactly when I come on. I appreciate all of you for what you do. And I look forward to talking to you guys tomorrow. Enjoy your day and stay blessed. And guys, remember, we can do this. You are victorious because that's who you are. And I believe in you. And I'll talk to you guys soon. Enjoy your evening and have a good night. Bye bye.